All right, so we are back. Welcome everybody to another edition of Truth and Healing. I'm Zeke Cohen. Really thrilled to be here with my good friend and co-pod Zoomcast host, Dr. Melissa Buckley. Dr. Buckley, how's life?
Everything is good. I am happy to be here as well. And hey, everybody.
Good to see you all. And Dr. Buckley, I know you wanted to plug our Lunch and Learn series before we get started with our two amazing guests today.
Can I just say that our first Lunch and Learn, if you missed it, you really missed some good information. But it's okay because it was recorded and it will be shared to our social media platforms, so you can always tune in later. But here's a really important thing about the Lunch and Learn series. For those of you who are licensed social workers and licensed counselors, you know you need CEs every year to keep your license active. Well, this is an opportunity to earn a free CE, and it's virtual. Our presenters yesterday were from Mariposa, and whew, the information was just phenomenal. They talked about basically emotional support and awareness for children and how that translates into adulthood. And we walked away with some gems. So looking forward on the third Thursday of
All right, so we are back. Welcome everybody to another edition of Truth and Healing. I'm Zeke Cohen. Really thrilled to be here with my good friend and co-pod Zoomcast host, Dr. Melissa Buckley. Dr. Buckley, how's life?
everything is good. I am happy to be here as well. And hey, everybody.
Good to see you all. And Dr. Buckley, I know you wanted to plug our Lunch and Learn series before we get started with our two amazing guests today.
Can I just say that our first Lunch and Learn, if you missed it, you really missed some good information. But it's okay because it was recorded and it will be shared to our social. You can always tune in later. But here's a really important thing about the Lunch and Learn series. For those of you who are licensed social workers and licensed counselors, you know you need CEs every year to keep your license active. Well, this is an opportunity to earn a free CE, and it's virtual. Our presenters yesterday were from Mariposa, and whew, the information was just phenomenal. They talked about basically emotional support and awareness for children and how that translates into adulthood. And we walked away with some gems. So looking forward to seeing everybody on the third Thursday of August. I forgot what month we were in. The third Thursday of August for our next Lunch and Learn.
And could you just tell folks just who are not clinicians, who do not need those CEs, we want everybody there too, right? I mean, this is a community-wide, everybody's invited kind of deal.
For sure, 100%. Thanks for that clarity. Yeah, everybody is invited. But if you do have a license, that's the benefit for you is that you walk away with a CE over your lunch hour. And a CE is a
Amazing.
continuing education unit for those who might be interested.
Well, listen, we have two amazing, amazing guests with us for this edition of Truth and Healing. And especially, Melissa, as we come out of hopefully turn the corner on COVID-19, although we know we're seeing a resurgence with the Delta variant. But as we start to move hopefully away from this awful pandemic that we've all been living through, more important than ever that we check in on each other's mental health. And so our two guests today, I could not think of anyone better to help us think through and navigate this moment that we are in. Being here in Baltimore, in a majority Black city, it is so important that we name and be explicit and clear about the need for Black mental health. And so one of our guests is in that arena and is amazing. And then, of course, just the overall health and mental health of our city. And so, Dr. Buckley, I'm going to let you do the pleasure of introducing our two guests for today.
Absolutely. And it is indeed my pleasure as a Black woman to bring these two powerhouse Black women to the stage, well, to the virtual stage. One of them you all have met previously with us last year, and that is Andrea Brown. And the other one you've probably seen on on the news and sharing really important information about the health of Baltimore City in terms of COVID, most certainly, and other things. So I'm really pleased to welcome Dr. Letitia Jaraza.
Good morning. Thanks so
Good
much for the
morning.
introduction, Dr. Buckley. And thank you, Councilman Cohen, for this invitation. Very excited to be here today and share the virtual stage with Andrea Brown. Again, another esteemed colleague in this space.
Thank you so much. It's very excited to be here. Really excited about a conversation that will make impact. And so again, thank you for having me. I'm super excited. And for some of you who didn't hear earlier, I told Dr. Daraza that I had my Adidas on today. So I'm super hyped and comfortable. And so I'm loving that inspiration when I see her out and about. So.
Amazing. So listen, the part of the premise of our Truth and Healing series is we know that public conversations about mental health and trauma can be really hard, right? Like there is stigma, there is pathology. It is just tough to talk about mental health for any number of reasons. And I'll say this, I am the son of a psychiatrist and a clinical social worker. I am the husband of a psychiatrist. So I feel like all day long, it's mental health conversations in my household. It's just the sort of cultural orientation I've got. But what I'm grateful to both of you, one of the things I'm grateful to both of you for is that you all have been really comfortable and fluent in talking about trauma and talking about the need for trauma-informed care and for conversations about mental health that leave people feeling affirmed and safe and all the rest. And so I'm curious if we could just start by think about you both as people and how you got here. So how, Andrea, did you become the leader of this important organization, the Black Mental Health Alliance? And then I want to go to Commissioner Jarasa.
So it's funny that you say that. As I was listening to you talk about your family and the structure, I really spent 17 years, I'm still 21, but 17 years at the NAACP as an activist, right? And so on the senior level, every time there was something going on, we were setting up sit-ins or teach-ins, that kind of thing. And it's funny, my mother is a clinical social worker, a licensed social worker, retired several years. And my father, actually, who is deceased now, was a circuit court judge. And I watched him, honestly, really give his life to service. And, he started as a social worker, but I watched as he saw men and women, young people come into his courtroom, just, on all the time. And he's like, there's got to be another way. Punishment can't look like this, right? It can't look like this. And he started a program over at Forest Park. He was an avid golfer, and he started a program over there so that young people could be exposed to something else other than detention, right? And so, and then, even when that wasn't enough, work with other partners to bring some other things in terms of what wasn't the norm. So it's all I know. It is all I know. And, I'm so glad you talked about, and I know Dr. Daraza is gonna share her story, but it's all I know. And, one of the things we were missing at the NAACP, who are my great friends, when we would get on the ground and, help Brown's family or help Troy Davis's family kind of reconcile, one of the components that we were missing was that we were not getting any help as a result of that. And as a Black woman to come home to a Black son, right? And I'm trying to process all of the things that happened. I was like, you know what? I can't coach from the sidelines anymore. I need to get in the game. And so that it just strategically a door opened, and that's how I got here. But it's all I really know.
Thank you so much for sharing that. The reality is, whatever type of work we do, we've all been called to it for a very specific reason. We can draw the line from our lived experience to the cause. And oftentimes that is what drives the passion and fuels us and keeps us going. I want to highlight the fact that this month is an important month in terms of Black mental health. Did you want to speak to that, Andrea? I don't want to.
No, it is. It is, we get excited because they call it BIPOC Mental Health Month. And that is, obviously Black, Indigenous, People of Color Month. And it really has given us an opportunity to help people understand how we get to reduce the stigma by lifting up this month, right? And then by lifting up what that really means in terms of how to get care, why it's important, finding your voice, all of those kinds of things. And then I know we may touch on it later, and really finding a clinician that can see through the lens that you need, because that right there is a game changer. And so this month is important because it really gives us a platform to have these kinds of conversations.
Absolutely. And to that point, Zeke, just indulge me for a quick moment. Finding a clinician is one of the most brave things that a person can do in their journey. Because when you're grappling with feeling like something isn't right, but not knowing what that something is, and then when you finally take that step to find a clinician, that is huge. So anybody who is watching this right now who is feeling like I might need help, I want to encourage you to get help. I myself have my own therapist. Okay, I see her matter of fact, my appointment is Friday at 9:30. And that's locked in. And then also, I am a licensed clinician. So I have my own clients that I see. And I really want to put that in context, because no matter who you are, where you fall on the spectrum, we all need help and support. A really, really amazing place where you can find Black clinicians, Therapy for Black Girls. If you guys are not familiar with that, I want to invite you on over to there. And there are other places, but I definitely want to plug Therapy for Black Girls. All right. Now, Dr. Jaraza, we want to hear what your story is. What fuels your passion?
Great, thanks, Dr. Buckley. It really dates back to when I was a kid. So believe it or not, at 5 years old, I told my mom I wanted to be a doctor. I had no idea what that meant. And now that I have a 4-year-old, I'm like, what was I thinking? Like, really? But I would go on to have an interest in science and, would go on to study and get into a science and tech program in high school. And then I got to college. I went to the University of Maryland, Baltimore County. And I had a mentor there who used to say, to whom much is given, much is required. And so early on, he instilled this notion, right, that if you have this opportunity, it's your responsibility, your obligation even, to give back and to serve others. So I truly believe, as a physician, as a human, we should be looking for ways to really serve others. As I got into medical school, I would go on and be instilled with the same thing. So I went to Meharry Medical College, and their motto was worship of God through service to mankind. So it's like this theme that kind of ran throughout my education. And I said, okay, well, how can I give back now that I'm in medical school? Now that I'm thinking through this, what does that really mean? I had an interesting personal story. So when I was in college, my favorite first cousin was diagnosed with paranoid schizophrenia. He and I are about the same age. And I think at the time, we didn't know what was going on. I just remember getting this call from my mom, like my first semester in college, that, he essentially had a psychotic break. And since then, again, has kind of been in and out of treatment, and we've seen, lapses. It certainly kind of waxes and wanes. And I think for me, it became, again, a personal mission, right? To understand, okay, how could we have helped? How can we continue to help? And how can we really serve others? And so I actually chose pediatrics as my specialty because I have just a heart for children in general. But certainly one of the things I learned during my residency at Hopkins was the importance of addressing the adverse childhood events, right? And so, my cousin, like many of us, experienced ACEs, and did they somehow contribute to some of his mental health challenges? Quite possibly, right? And so I think for me, it became, okay, what can I do to make sure that I'm serving others and giving back in whatever seat I sit in, whether it was as a primary care provider, when I saw patients as a pediatrician full time, and now being on this side of thing, where I'm fortunate because this is a role that sits kind of at the intersection of advocacy and promoting policy change, and you also have this opportunity to implement programs. And so I kind of, it's kind of a roundabout way, but that is how I got here, and that is definitely what fuels me.
Thank you so much for sharing. And even though, sure, it is roundabout, but you can certainly see how it all connects. And big shout out to the HBCU connection there as well.
Yeah, and I wanted to just pick up on both the points from Andrea and Commissioner Jarasa, just on this idea of the connection between service and mental health. Because similarly, growing up, for me, my mother was incredibly active during the civil rights movement, during protests against the Vietnam War. Her conception of what it meant to be Jewish was really rooted in this idea of tikkun olam, which means to heal the world. And just like you were both saying, that I think to my mom, it was like, all right, well, start with the Mississippi Freedom Summer and then go toward protesting against escalating violence in Vietnam, and then move toward social work school and getting a clinical PhD, and ultimately spending 37 years at Smith College teaching social work to folks, around, and also having her own clinical practice as well. And so to me, there is this deep, almost spiritual connection between social justice, Andrea, what you were mentioning with the NAACP and sort of the movement, and mental health. and just the connection between the two and the need for support, and to make sure none of us, no matter your condition, whether it's paranoid schizophrenia or anything else, are left behind by our systems and our city and our country. And so again, I just think there is something profound in what you both said. I wanted to ask specifically about this pandemic that we have found ourselves in, and major props and kudos to Dr. Jaraza for her just incredibly able leadership, and just walking the walk as it relates to being a leader in this moment with COVID-19, with all the excellent messaging that the health department has done, with really, using the science to guide how we either opened or did not open back up, getting our vaccination sites set up. I have to really give a lot of credit to our health commissioner as well as her staff, because it's really been a Herculean effort, and seeing some of it behind the scenes, it is tough work. I want to talk specifically about mental health, which I think is often ignored or downplayed in a global health pandemic like COVID-19. But what we know is that the mental health impacts can actually linger and outlast the physical health impacts of something like SARS-CoV-19. So I want to talk about both where we are as we come out of this virus as it relates to mental health. And I also want to talk about the sort of specific, unique circumstances where not only did we have this global pandemic, but we also had this uprising against racism and violence, really jumping off with the murder of George Floyd and so many other Black folks in police custody. Just the intensity of both the health pandemic and then the ongoing epidemic of racism within our country. I'm wondering how you both think about this moment that we're now in, and how do we heal from it? How do we come out not okay, because I don't think that's quite realistic, but how do we take where we are and as a community, as a city, as a society, as a country, move toward a better place? Maybe starting with Andrea.
So, it's interesting when the pandemic happened, when it started, I had just started at BMHA. I didn't know the staff. Thank God they were small. I'm like, you work here? I work here? Oh, okay. And so, but we did an emergency town hall meeting. Didn't know what it was going to look like. Had no, and one of the subtitles was, when America catches a cold, the Black community catches pneumonia. And it wasn't meant to be funny. It really was meant to say, we don't have any idea what this impact is going to really look like for us. And so as I listen to you, and as we hear people talk about, some people talk about the global pandemic, the twin pandemics, obviously, COVID, and then, this heightened racism in communities of color. And so it has, if we want to talk about a sucker punch, right? For those who that's really what has happened. And so it's interesting as people start to talk about the road to recovery. And I don't know what that's going to look like. I don't even know that we're there yet in terms of mental health. And not only have we seen then and now, have we seen our referrals jump through the roof. People from across the country, North Dakota, are calling us looking for a clinician who is culturally grounded, right? And so, so really sort of helping people sort of navigate those waters. And some of what we've said is, okay, what's the collateral damage to Black people? Because it's going to, again, look different, not just with our kids in school, but really trying to message that we've got to find voice, and our silence won't protect us. That's what we've said the entire year. We started off this year with, this whole notion around radical self-care, because especially historically as Black people, we don't take care of ourselves. We take care of everybody else. And then I think we've got to acknowledge that there's real pain and disruption. And so you talked about George Floyd, as a Black woman, I still can't even wrap my mind around the fact that Breonna Taylor, right, her rest was broken, that you would break the rest of a Black woman who is, so the matriarch and all of these other things. And so for Black women having to navigate those murky waters, and so we continue to have the conversation. We continue to push, healing-centered engagement, finding safe spaces where we can have the conversation. And this is the last thing that I'll say about that. I really want to caution us about, this, when we start to talk about trauma and, trauma-based treatment and those things are important, but we got to be mindful about, trauma porn too, right? So I refuse to let us be the next sexy thing that you want to talk about. But I think putting real systems in place so that whatever this, as we come out of, right, whatever this comes out of, that we can sort of slow step. I don't know what the road to recovery is, and as we look at mental health, but what I do know is that we've got to start having conversations and providing safe spaces for people to talk.
Yeah, I think I completely agree with everything Andrea said. And I think, one of the things that she said is she mentioned having a safe space. I also think give yourself space to mourn. I saw a post on a social media, I think it was, where someone was saying, I don't want to be called resilient. Right? Like we constantly hear that word and I understand the context. I understand why we use that word. But at some point we shouldn't have to feel like I have to be resilient. I'm so resilient. Certainly when we think about our children, we use that word, but the point is we don't want them to have to deal with that, right? Like we should really be focusing upstream on what are we doing around prevention, so that they don't have to be resilient, right? They get to be kids. And so I think that's a big piece of it, right? So thinking about whatever your corner, whatever your space in the world is, there is something you can do, right? Like we can't wait for the Calvary to come in and save us. What can you actually do once you've given yourself that space to grieve and to mourn and to process and to seek additional help or support if you need it? What can you do? Like how can you act? Because we know that policy change is going to be necessary to really disrupt what we've seen across the country. And so thinking about, even if you're a student, what can you do? Can you organize with other students? Can you be a voice? Can you work at the local level? I really appreciate how Councilman Cohen in particular, and certainly Mayor Scott is very interested in what our young people have to say, right? Like, because they come with these great ideas that can help us really disrupt and break this cycle and prevent these things from happening in the first place.
Thank you both for your comments. Anytime, as a social worker, whenever I hear, mention of policy, my ears perk up because I know that change does not happen without policy changes, without structural changes. So we can sit around and talk, which is a necessary part of the journey. It's a part of the healing, actually. But if we are not restructuring policies, then it's all for naught. So thank you both again for your comments. Dr. Jaraza, you talked about what are some of the things that we can do. And I think that that's a poignant question. So I would like to ask you to respond to the next question. Why is it important that our city has become the first in the country to be fully trauma responsive? What does that mean? And then especially since we're coming out of the pandemic and the epidemic of gun violence, why is addressing trauma so critical?
Yeah, that's a great question. So, I began to speak about it in my previous discussion, right? So really and truly addressing and better yet preventing trauma is critical to impacting health outcomes for our children, for our community, right? So I mentioned the adverse childhood events. And what we know, it is proven that exposure, chronic and acute exposure to adverse childhood events, these are things like witnessing violence, being a victim of violence, your parents separating, having substance use disorder exposure, all of these things contribute to long-term health outcomes. We know that young people who experience this have greater risk of high-risk behaviors when they get older, greater risk of having PTSD, greater risk of heart disease and stroke. And these things are preventable, right? And so I think that for me, again, is why I'm so passionate, because we can actually do something before it happens. And so it's so crucial that as a city, we think about this. How do we become trauma responsive? How do we prevent, trauma and exposure to trauma from happening before kids are even exposed to it? So I think it's extremely critical that the city is moving in this direction. And I think Baltimore City also has this history of being innovative in the public health space. And so I think we're so uniquely positioned to be fully trauma responsive as a city. We have city leadership that is supportive, and that's also huge. And I believe that we have the resources and we have the commitment to the mission. So I'm excited as we're moving in this direction because it's so important that we work upstream and work to prevent.
Yeah, and I know that, as we were thinking through and beginning the process of sort of ideating around the Healing City Act and making Baltimore trauma responsive from a legislative lens, I remember one of the first conversations I had was with Dr. Gerasa as she was preparing to become health commissioner. And I remember asking, like, what's your priority? What do you want to see? And she said, I paraphrase, but basically said like that we deal with adverse childhood experiences and that we address childhood trauma. And, again, for me as a legislator who's spent a lot of my previous career directly working with kids as a teacher and as a nonprofit director, working on organizing and advocacy with young people, that was part of what lit me up about this opportunity that we had to have a health commissioner who, like, that's what they want to see, and then to now have a mayor who really believes in it, to have public and private partnership and so many great partners like Open Society Institute and Holistic Life Foundation and all the many organizations that are contributing to this work, I think is huge. And I agree that Baltimore has a history of being innovative in public health. And I think we just have a profound opportunity with this work as well. Andrea, question for you. You talked a little bit earlier about radical self-care. Was hoping that you could define that term and also share with us just what our listeners, what folks can do who are going through it or who are sort of teetering. I just think I've had a lot of friends during this pandemic that have either gone through divorce or have had intimate partner violence creep into their relationship, or, we've seen a rise in child abuse. I get the sense from every conversation that I have with friends, with family, with constituents, that everybody is like teetering. And I sometimes feel it myself too, like just feeling more stressed out, more anxious, more like, things that like a year and a half ago, I could just kind of be like, all right, well, whatever, will like bother me. And so I just feel like we're in this kind of collective stress morass. So I'm curious about this concept of radical self-care and really what listeners can do to address our own suffering and our own healing.
Yeah, no, thanks. It is, it's funny because, it's sort of catching on in the office about what does radical self-care really look like. And one of the things that Dr. DeRaza said, which I can certainly appreciate, is, whether you go here or go there, but you find a space, right? wherever that is that you live, find a space that you can be quiet, a safe space. So some of that is really building in intentional time to check in with yourself. How did that look for me today? How did I show up today? And here's the other thing. We keep stressing there really is still this stigma around mental health, especially for Black people. And some of what we've been saying, especially this year to our young people, is have the conversation, begin to talk to your peers. What does that look like? So again, finding a safe space, finding a conversation, and then really checking in with yourself and others and being accountable. So that's some of it. So we talk often about, when we talk about radical self-care, I'm a big reader, and I love Audre Lorde's work. And, she often talks about, well, not now, but she's deceased, but, talks about self-care as it's the act of political resistance. When you take care of yourself, then you get to show up. But we've got to know how to do that. And so there are a couple of things. One of the things that we talk about is this express. People say, oh yeah, I'm going to take care of myself. I'm going to, it's like driving through McDonald's and getting something. I'm sorry I'm saying this in front of the health commissioner. I promise I don't eat at McDonald's, but I'm just using that as an example. But driving through McDonald's, getting something quick, right? Or getting the veggie burger at Burger King. So that's, we know, is express, sort of. And then there's the restaurant experience. And the restaurant experience is I go in, I sit down, I decompress, and then the waiter comes over and he asks me 100 times, or she asks 100 times, can I fill your glass? 100 times. And so we use that analogy about filling ourselves, right? And it looks different for everybody, but it is necessary. And so whatever that has to be, and we've been pushing people to get connected through music. There's a healing element in music. Black people love music. And so, and that's not a stereotype, that is true. That is how we are connected in many ways. And so, and then again, we, as much as we possibly can, we talk to people about getting in these groups, whether there's healing-centered engagement circles, emotional emancipation circles. Now some of those are available online through reading. And so we've been pushing people. Here are some small tools that you can use, because folk always say, I don't have the money to go here, but those are small things that you can do. Be still, journal. That's radical self-care. It may not seem like radical self-care, but it is. And especially in these moments, right? We got to be able to talk to somebody, and we've got to make sure that our children know to talk to people. I think I shared earlier, I have a 17-year-old, but we've been doing a lot of work at BMHA with young people. And so we've been pushing them to through their poetry, to talk about what they're feeling. And they've been amazing. So we've partnered with Do More Poetry and some others to really talk about their mental health. But, again, during this pandemic, making sure they get the opportunity to find their voice, right? And to be still when needed to be still. And then again, to find a clinician, find a clinician who can see through your lens. So those are small things, but so. Oh.
Ooh, she needs
I remember those days. My 17-year-old, who is now 6'3", I don't want him on my lap.
But I'm sure if given the opportunity, he would jump in your lap.
Yeah, yes, he would. And I'm so thankful for that. But so yeah.
Go ahead, Zeke. I wanted to respond to Andrea, but go ahead. I'll go after you.
Now, before turning over to my great partner to respond and then ask our last question, I just wanted to shout out briefly Andrea, because we were both on a call with the Youth Healing Alliance. And what you were talking about initially about just having the courage to speak it out loud. This was just a really powerful group of young people. Yes, baby, you can have a mint. There you go. It was a really powerful group of young people. Sorry, I'm dadding behind the scenes.
Don't apologize.
On the call that we were on, it was about young Black men and mental health and just the level of honesty and vulnerability, and that they were clear about their own, their own stuff, but also just so thoughtful in giving other people space to share. And, I think what, again, always like heartens me about Baltimore is that I feel like in some ways we are so ahead of the curve, and there are these proof points and examples of how we see this playing out in real life. So just wanted to shout out, because I know you were there too, but shout out to Youth Healing Alliance.
Absolutely. Thank you.
So in response to your comments, real briefly, Andrea, you said a lot. And I think that what I really want to pull out from that is the need for, first of all, thank you for quoting Audre Lorde. I love her as well. And I definitely see self-care as an act of political warfare. And, I actually have my students doing a monthly self-care assignment each semester. They are required to do a self-care assignment. And, when it's freshmen and sophomores, they come in and like, oh my God, we have to do another matriculated through. What I find, and my colleagues also have incorporated self-care assignments, what I have found is that they have begun to embrace it as a necessity and as a way of life, not as something that is optional. And it does help us to obviously balance all of our stressors, and we get to pay attention to those areas of our life that otherwise get neglected. Now, the transparency piece that you noted, just in terms of being honest about what we're feeling. I can remember last year, and I'm very open about this. Last year, because of the isolation, I remember I was coming back home one day because I went out for a jog. This is when the gyms were closed, so you had to do what you could. And the closer I got back to my house, I was in tears because I was like, I have to be at home again. I felt like the walls were caving in. And so whoever's watching this, I share this because I need y'all to know you're not the only ones. Everybody feels pain, but we all can and should get support and get help so that we can feel better. So thank you for your comments, Andrea. Dr. Jaraza, the last question is for you. While most cities and states are beginning to peel back their restrictions, we are beginning to see the rise of the Delta variant across the country and the world. How concerned should we be here in Baltimore City? And what should we be doing to avoid getting sick?
So first things first, if you have not already been vaccinated, you should get fully vaccinated, right? For anyone who follows our dashboard at coronavirus.baltimorecity.gov, I'm hoping you've seen how we have seen this significant drop in new cases. That's because people are getting vaccinated. 73% of our adults above the age of 60 have received at least a first or single dose, which is wonderful because that's such a high risk population. We see that over 60% of all residents above the age of 18 in the city have gotten a first or single dose. Fully vaccinated, 2 doses if it's Pfizer or Moderna, or 1 dose of the Johnson & Johnson vaccine. But that, it seems like there should be a more complicated answer, but that is essentially the answer. Please, please, please get vaccinated. I fully acknowledge and realize that there's misinformation, but there's also historical truths, right, that might contribute to hesitancy or concern over getting vaccinated. If that's the case, I always encourage people, go to trusted sources to get your information. Talk with your primary care physician. Talk with someone, again, who you trust to provide you with accurate and up-to-date information, even if it's not our website, which has some of that at coronavirus.baltimorecity.gov. One of the things that we've worked to do at the health department is to really provide access. So we have a lot of mobile vaccination units that are going into communities that we know have low vaccination coverage. So as excited as I am that we've got 60% of all adults with at least a first or single dose, what we also recognize is that there are areas of the city, there are certain communities that have much lower vaccination rates. And so we really have to work within our communities to provide them with appropriate information so that people can make an informed decision. So when I think about the Delta variant, again, I think my concern really lies around those that are not fully vaccinated or not vaccinated at all. Because that's where I think we risk seeing the spread. And why that's even more scary for me is because we are seeing disparate rates of vaccination among our African American community. So again, I fully acknowledge there are lots of reasons why people might hesitate or pause on getting vaccinated, but please get the accurate and up-to-date information so that you can make that informed decision and get vaccinated.
Excellent. Well, listen, I want to just close, in addressing where both of you started, which is, I think that the work around public health and mental health really is social justice work, that creating the space for Black folks, for Native American folks, for Hispanic, Latino folks, for Asian folks, for Jewish folks, for white folks, for any of us to be able to have conversations about our health out loud is a radical act and is an act of justice, and is really something that has been denied throughout a lot of our history. We think about even now our undocumented, uninsured brothers, sisters, and siblings in our city who often can't get mental health care. We think about, again, the way in which, to Commissioner Jarasa's point, there is this lived history and these truths around the way, particularly Black folks, data has been manipulated, the way that mental health, certain communities have been pathologized and considered to be crazy and abnormal. We have a lot of history to unpack in these conversations, but I think they are so absolutely critical. And it is just an honor and a pleasure to get to go deep with you all here today and just to watch and witness the work that you're doing. And so I'll turn it over to my friend and my colleague, and one of my heroes as well, Dr. Buckley, to close us out. But again, I just want to thank Andrea, Letitia, just for coming on and really being yourselves and being vulnerable and sharing. It's just been great to get this time with you all.
I definitely share those sentiments, Zeke. This conversation is an ongoing conversation. But spending the time with you both today, I found that not only was it empowering, it was extremely informative, and it also was encouraging. We got some tools from our time together, and I hope that our listeners feel the same way. I want to reiterate, like I said earlier, I made mention of therapy for Black girls. That's not just for Black folks. Like I have non-Black clients who found us, the agency that I work for, they found us on Therapy for Black Girls. So anybody can find support, and it's not just for women either, men. We invite you into this space as well to get the support that you need. Wherever you find a therapist, just Google therapist near me. I promise you, you will find someone. You'll find the right fit for you. Remember that policy change is necessary. We heard Dr. Jaraza's comments around that. So that means that we all have to still do our part in terms of the advocacy. We have to be the voice. We have to be the feet on the ground. We have to be the ones who are willing to fight and kick down barriers. We also heard, what can we do? That question is something that we must all grapple with individually, but there is power in numbers. So let's join groups and organizations. Dr. Jaraza, if I remember correctly, you're a member of Alpha Kappa Alpha. Is that so?
I am not. I don't have any Greek affiliation, actually.
Okay, because I remember reading something about AKAs and their connection to the National Alliance on Mental illness. And so I was going to point out the fact that, Andrea and I are both members of Delta Sigma Theta, and we have a mental health awareness thrust. There are many, many, many ways that you can partner with organizations if you don't feel like you can do this work by yourself. And you shouldn't be doing the work by yourself anyway. And certainly partner with Healing City Baltimore. Listen, folks, trauma can be prevented. That's the direction that we want to go in. Yes, we are working on healing from trauma, but more importantly, we want to prevent trauma. We want to stop pathologizing people who have been traumatized. We want to remove the stigma around mental health treatment in the Black community, in the Brown community, in the community at large. We want people to be healthy. We want people to be safe. And we want to ultimately heal from trauma and experience lifelong healing. Thank you so much again, Andrea Brown and Dr. Letitia Jaraza, for your time, for your passion, for your commitment to this work. And we hope that you will join us again on another Truth and Healing conversation.
Thank you.
Thank you.
And thank you to our amazing audience for tuning in every week. It is always our pleasure to be with you, and we look forward to seeing you real soon. Again, this is Truth and Healing, and we're out.